Hey guys, so thoracic spine pain is super common during pregnancy. And unfortunately, like some other musculoskeletal injuries too, it does not usually go away after postpartum. Sometimes it can actually be worse from carrying and breastfeeding and doing all the things that you need to do to take care of your infant. So a couple tips are thoracic, your mid back, like right by your bra line. That mid back section can be really irritated because if we have sitting jobs or we sit a lot, and then the extra weight that we gain during pregnancy. So basically, what we're trying to do is kind of fight gravity. We're always stuck in these flexion positions, so we're trying to pull ourselves into extension. And making a guide too, it's so hard because there's so many different tools or things that you could use, but we want them to keep all of the equipment at minimal. So these are a couple tips. If you have a foam roller, this works really well. If you don't have to go out and get one, but you could just roll up a towel like this. So a couple of tips would be to try to foam roll out your back. Now, the thoracic spine is a very acute angle, so it's really steep. So what that means to you guys is when you're on the foam roller, you can't really lay flat and roll out your thoracic spine, or you shouldn't. So if I go both hands behind my head like I'm sun tanning, I can roll out my back using my legs to move myself up and down here. And then too, if you hear cracking or popping, that's okay, it's just joints moving that haven't got movement in them for a while. The other thing would be, so if you know like really specifically at one spot that's irritating you, you can put that spot right on the foam roller, and then I can flex back and then up, flex back and up. I can also take my hands and kind of reach them up and over as I'm doing that. And then when I was doing the foam roller before, so you really want your butt high, so that's what I mean by that like sharp angle. Your butt should be a little bit higher, and then it's just more specific to those joints. So obviously you can't do the rolling with this, but you can lay this down and then you can kind of hinge up and over it. The other thing would be there are long ligaments. So your anterior and posterior longitudinal ligaments go on the front and the back of your spine. During pregnancy, or anytime we're stuck in these flexion positions, our anterior ligament gets really tight and our posterior ligament gets overstretched. And so what you would want to do to kind of combat that is take this and lay on it lengthwise on your back. So I'm going along the spine, so my head and my butt are on that. And then I really like to hold on to like 5-pound dumbbells when I do that. But what that looks like is my butt goes on here, head goes on here. I lay all the way down and palms go up towards the ceiling. The further back your thumbs are towards the floor, the more of a stretch you'll feel as well. And then also to taking breaks. So if you do have to sit a lot for work, the other thing you can do during the day is actually some extensions right on your chair. And what I do is scoot my butt further and further away from the chair to make it just a different angle. The other thing would be grabbing a countertop, and so there's a counter right in front of us. So if I put my hands here on the countertop, I'm pulling my chest towards the floor. So I'm acting like there's an anchor, like right by that bra strap, pulling me down towards the floor. So pulling you down towards the floor. Then, although this section too is in charge of a lot of rotation, so then what I do is I move my hands here and then drop again. So just to one side, drop, to the other side, drop. And that being said too, I can extend and like kind of reach up and extend and reach up. So those are simple stretches. They honestly only take like 5 minutes. They can make a huge difference. I do those all the time with the kids because my back gets sore just from being stuck in flexion. So hopefully those are some helpful tips. And it's honestly just good for your spine. The other biggest tip I have for you guys is if you have the guide and you're not doing the if you're not doing the entirety of the guide, you're really missing out because strength is the biggest thing. So Amy and I both had severe mid-back pain with our first before the guide was created. And then with the second I didn't have any. So a huge piece of that is just combating some of those strength muscles. So our inner scapular muscles, so rows, reverse flies, things that help strengthen this area. Those pull aparts with the resistance band, pull aparts overhead, all those things are going to help us to be stronger so that we don't get in those compromised positions to start with. But strength is the key to fixing it, but the flexibility stuff sure does feel good when you're in pain. So hopefully those are helpful tips.